про платформ. И у нас в гостях сегодня гость, да. У нас в гостях сегодня гость из Соединенных Штатов. Вот. Кто слышит меня сейчас, можете сказать, как со звуком? И мы начнем наш эфир. Нормально слышно? Настя, вы слушаете, да, я вижу. Hey Mario, wait a second. Yeah, we will check the sound. If everything is okay, and yeah, I will send you an invitation. Как держать? Вот так, да, держать? Ну, в смысле, вот так мне все время разговаривать. Да? Если далеко, если висит, не слышно, да? Я правильно понимаю? Ой, с этими техническими устройствами уже это чуть-чуть, потеряли навык. Последние наши эфиры были в живом режиме, да. Вот. Как-то это. Ладно, буду так держать, если вдруг отпущу, вы скажите мне, тогда я поближе микрофон сделаю. Так, я послала приглашение нашему гостю. Пока он его принимает, я скажу, кто у нас сегодня в гостях. Hey Mario, yeah. Hi, I'm good. Yeah, thanks. I just started to introduce you, but let me, first introduce you in Russian, and then we will start to talk with you. Yeah. Yeah, thanks for saying that you accept our invitation to be a guest here.
Yeah, I'm happy to be here.
Yeah, thanks. Окей, сегодня у нас в гостях доктор Марио Роча. Он специалист по семейной терапии, по терапии пар. У него очень большой бэкграунд по работе с травмой. И, насколько я знаю, у доктора Марио будет скоро новый интересный такой большой проект по секс-трафикинг. Sorry, I don't know how it sounds in Russian. Это секс-трафик, наверное, так и переводят, да, на русский язык. И вот доктор Марио согласился быть гостем, и Настя мне, подсказывает, те, кто нас сейчас смотрит и не владеет английским языком, я буду говорить с Марио на английском, но я буду сама же переводить. То есть будет такой последовательный перевод. Если кто понимает по-английски, вы можете задавать вопросы на английском, но если не будет вопросов на английском, вы говорите мне на русском, я переведу. То есть я буду переводить себя и Марио. Okay, Mario, hello again. I just introduced you, but I know you speak some Russian, I suppose.
Yeah, picking up a little bit, yeah.
Yeah, I understood some of the words I kind of told about. Okay, we have some questions, but before we will start from these questions, maybe I will ask you the first one. Why this field of psychotherapy? I mean, I'm also a psychotherapist, but my field is addiction, drug addiction, alcohol addiction,
Okay.
and your main topic is family and couple therapy. So why this topic? Why did you choose to be professional on this topic? And wait a second, I will translate what I asked. Я спросила только что доктора Марио о том, почему он выбрал именно эту специализацию, эту область в психотерапии, быть семейным терапевтом. Okay, yeah, it's interesting.
Yeah. So I also started doing addiction counseling. That's how I started.
Okay.
So I actually worked in prison and helping inmates with addiction. And I grew up in a family that had a lot of addiction, a lot of like gang violence type of things. So I kind of saw the destructive patterns of family dynamics and mental health issues. So that's what kind of got me into wanting to help. I just wanted to help people. So I started with addiction, and then I just got more interested in psychology as I kind of learned more. But I also work with a lot of individuals and a lot of trauma as well. That's something I also work with.
Yeah, okay. I will translate, yeah. So I'm not professional translator. If I will try and translate sense, not literally. What did you say? Да, доктор Марио только что сказал, что также он начинал с аддикции. Вот это была его первичная, да, так сказать, сфера, где он был практикующим психологом, и потом он, естественно, начал интересоваться больше психологией. Он также работал в тюрьме. И такой у него бэкграунд, связанный с девиациями. Ну и потом он решил, что будет специализироваться на family, на семейной терапии, sorry. So, actually, you decided to be a family therapist after this topic with addiction, or how did it work? I mean, I'm just curious. It was not. It's addiction is one field, yeah. Deviation, right. Prison, all these things, but family, couple, it's completely different.
Right.
Not completely, but anyway, yeah.
Right. So here, I started working in addiction counseling just with a certificate. So with that work, I went back to school and studied psychology, and I went to get my master's degree. And so as I was studying more psychology, I just got more interested in family dynamics and how it affects our psychology, how it affects also, people getting into addiction. And I'll talk a little bit about that too as we go forward. But our family dynamics influence a lot of how we develop our individual psychology. So that's what really got me interested in it, and just starting to learn and study that. So that's why I kind of went for it.
Okay, cool. It's very similar with me because in addiction field, in addiction topic, I mean, in the hospital where I work now, I work with the family. That's true. Okay, I will give translation to our listeners and who are watching us now. Доктор Марио сказал, что когда он работал консультантом по аддикциям, он начал изучать, конечно, больше психологию, и он понял, что именно семейная психология, она очень сильно связана как бы с индивидуальной, да, психологией, и она очень сильно влияет на вот эту индивидуальную психологию. И поэтому он решил стать именно специалистом в сфере семьи. Очень короткий у меня получился перевод, но я думаю, что, возможно, когда эфир закончится, мы, когда будем делать репост этого видео, мы сделаем дословный перевод в виде субтитров. So, okay, I told that I kind of gave a short translation of what did you say, what you said, but I promise that we will do subtitles after, because you're speaking really good and I translate in only common sense. Okay, family system, family therapy, and now you have a lot of years, in this field, experience. So how many years in the field of family therapy?
It's probably close to 10 years now, if I count my training. Yeah, it's about 10 years. So in that, I worked a lot of different places. So I worked with severe mental illness. I do work with a lot of individuals. I actually work with more individual therapy now. But still, I see a lot of couples and families as well.
Окей. Да, доктор Марио начинал работать с личностными расстройствами. Вот, 10 лет у него опыт работы, и сейчас он занимается индивидуальной терапией и терапией пар. Okay, but I'm just curious. For example, I really like more, group therapy. I do individual therapy, but, I never did couple therapy. And I can maybe say that family therapy, anyway, it is group therapy. Yeah? But I do individual therapy very... Comparing to group therapy, more, not so often. So I have more energy in the field of group therapy. I am telling you that. What about you? What do you like more? I mean, to be a therapist in individual therapy, couple therapy, family, where kind of you get this you know, sometimes when we feel that we really enjoy from this work, from this job, from this things that we do, what do you like more? I mean. Wait a second, I will translate my question, sorry. Я спросила доктора Марио, да, что ему нравится больше, быть индивидуальным терапевтом, работать с группой, с семьей, где он больше получает энергию, то есть что ему нравится больше. Окей.
So I think it changes over my career, kind of changed. Okay. Right now, in the past like year and a half, I worked with more couples than I have in my whole career. And I'm kind of actually enjoying couples now. But I also like individual therapy with trauma. So I kind of like a variety. So, so I work with a lot of trauma, a lot of individual therapy with trauma, a lot of couples. But if I kind of approach it the same way, I use a very like psychoanalytic kind of approach in couples therapy and in individual therapy. So I kind of go underneath the problem and figure out what kind of unconscious defense mechanisms are coming out, stuff like that. So I like couples right now, but I also enjoy individuals. So a variety, I guess.
Okay, variety, yeah, it depends, yeah. Yeah, it's interesting, yeah, I will give short translation. Доктор Марио сказал, что зависит, да, то есть ему когда-то нравилось работать в индивидуальной терапии, работать с травмой, но ему также нравится работать с парами. Он начинал с психоаналитического направления, да, вот эти все вещи, связанные с психоанализом, бессознательное, механизмы защиты. И то есть все-таки зависит от времени и нет четкого такого как бы предпочтения. So I just told that it's like you don't actually choose, yeah, which one is better. As me, for example, I told I like group therapy more, but for you it's like I like both, yeah.
Right.
Да, что для доктора Марио оба, да, вида терапии, индивидуальная и групповая, и терапия с травмой, все очень нравится. So you kind of really like to be a therapist.
Right, yeah, I do. I love psychology, I love theory, I love working with people. Yeah, for sure.
Yes. Да, доктор Марио говорит, что я люблю психологию людей, да, конечно, мне нравится быть терапевтом. Okay, yeah, that's cool. So I will start from the questions that we had actually yesterday. Yeah, my students, they asked you these questions. And if someone wants to ask our guest now, you can ask. Yeah, we also can answer any questions. Okay, so the first question was about, sorry, I have to read it. The first question was about, it's a kind of common question. So when people usually asking for help exactly in family therapy, when you need family therapy, what cases?
Well, if you're a family therapist, you would say that any problem within the family, even if it's with one child, there's a family system problem.
Если у вас есть Yes, sorry. Yes, I want to give direct. Да, если у вас есть проблема, любая проблема вообще связана с семьей, потому что ребенок — это часть семьи.
Yeah, so I think it can be used for anything, but really most of the time when I see families, it's most of the time there's relationship conflicts that are impacting the kids, that there is maybe one kid that's acting out really bad and it's affecting the whole family, stuff like that.
Ага, обычно это бывают разные случаи, но чаще всего, когда один ребенок себя ведет неподходящим образом, да, и, ну, как бы семья на него жалуется. Ага, окей, yeah.
So a family therapist would say that, again, an individual psychology is reflection of the whole family system.
Индивидуальная психология – это отражение целой семейной системы, так говорят семейные терапевты. Окей, yeah, that's true. We are part of the family system, yeah.
Yeah, so the family has a system and how they flow. Right? Even if it's dysfunctional, the flow of the system keeps it together. It keeps it flowing.
Даже если система семьи, то, что называется дисфункциональная, но тем не менее, как бы в системе есть вот эти связи и потоки, да, то, что называется. Okay, yeah. So you are, I forgot to say, people, that you are specialist on family system theories. So it's kind of very cool topic. I was always interested, but I don't know many things about that. Да, доктор Марио еще специалист по семейным системам, поэтому если у вас будут какие-то вопросы, можно задать. Okay, yes. Okay, continue, yeah.
So an example that can maybe explain it is like, let's say a kid is getting in trouble in school. And so
если ребенок попал в неприятности в школе. So sorry, because if I will be given a sense, it will be difficult. So I will try to be very clear. I'm not professional interpreter, but anyway, there are someone who there are some professional interpreters who are watching us. So if you can help, just maybe write a comment if I kind of not so exact with translation. Okay, yeah. So if a child in the school have some problem?
Right. So let's say the reason they're acting out is because there's a lot of marital conflict with mom and dad. Right.
Что у него может быть очень много конфликтов с мамой и папой.
So an individual therapist might say, well, the child's angry, right? And he's seeing a lot of arguments and violence maybe, so he's acting that out in school.
Ага, и, например, индивидуальный терапевт, он скажет, этот ребенок видит очень много насилия, да, в семье, споров разных между родителями, поэтому он себя ведет так в школе.
So one way a family therapist might see that is that maybe the kid is acting out and that's the only time the parents stop fighting because all the attention goes to him. And maybe, maybe the parents stop arguing and they work together to help him. So that creates some stability in the family system.
Okay. Okay, I got it. Yes. Yes, there is a difference. I can see also now. Yes. Да, что семейный терапевт смотрит не столько на проблему, да, как частную ребенка, он видит семейную систему в целом и говорит, что, возможно, если родители перестанут между собой ругаться и спорить, тогда это поведение у ребенка пройдет, и он не будет себя вести в школе таким образом. Okay, yes, yeah. Okay, so it's individual therapist. It's more like if I treat this boy, let's call it him like that, yeah. I will be working more on acting out this aggression, yeah. But if I am family therapist, I will be working with family and maybe ask to join the whole family to my therapy session.
Right. So we would be actually focusing a lot on the parents and how they interact and how it's affecting the whole family system. And the idea is once the parents fix their issues, then the behavior with the kid will kind of go away because his behavior is a result of the marital issues.
Окей. То есть, да, если пригласить всю семью и работать с семьей, и если родители перестанут действительно между собой спорить, то тогда, ну, проблема ребенка будет решена. И я спросила о том, что индивидуальный терапевт чуть по-другому, да, работает. Он больше нацелен на то, чтобы отреагировать это поведение, а семейный терапевт на изменение семейной системы. Yes, okay. And my another question, but if you have such clients, for example, you know, on my experience, on my personal experience, I have many, let's call it calls. They are not my clients, but usually parents are calling and tell, do something with my boy. He has computer addiction. Okay, okay, this is the usual type of calls. But they are usually refused here. I mean, in Kyrgyzstan, because we are looking on the family therapy now from your perspective. Yeah, it's the experience of United States. But here in Kyrgyzstan, people usually are not so kind of involving in this process of therapy. It's very rare occasion, you know, when people really want to cooperate, when parents want to cooperate. Yeah, but how this situation in United States, so on your experience, is it different? They like cooperation, they ask for help.
It's not too much different, I think, especially now. When I actually first started, I saw more families. But lately, in the recent years, it's kind of similar. We're seeing less families, and it is more like, hey, fix my kid for me, and they leave, right? So it's kind of similar in what I've been seeing more recently.
Окей, окей. Я спросила доктора Марио, что здесь, в Киргизии, например, очень часто отказываются работать вместе с детьми, то есть звонят психологам и говорят, возьмите ребенка на консультацию, но сделайте с ним что-нибудь. А сами отказываются сотрудничать. Но и доктор Марио говорит, что в Соединенных Штатах ситуация такая же, то есть мы в этом смысле не отличаемся. То есть примерно очень похоже тоже, так же себя ведут родители. Okay, yeah, so it's very similar. So the parents and the family are the same everywhere, yeah, and the family system is the same actually, yeah, but we are collectivistic type of culture, that's a sin, because we are in Central Asia, and America is more individualistic, yeah, kind of type of culture. But anyway, it's the same, the same idea. It's interesting. Okay. And what do you usually do? I mean, about this topic?
Yeah, it depends. So sometimes all we can do is just work with the individual and kind of let them see how their family system is affecting them. And maybe learn how to set boundaries or, learn how to heal from their past or something like that. Sometimes I worked in some clinics where the parents had to be there. It was kind of like mandatory. So sometimes when you get that, you have to work through the resistance of the family. And sometimes in family therapy, they will pull you into their family system. They'll try to pull you into how they work. And that's actually a good thing for us because we can see what's happening and kind of work with it.
Yes, okay. I will try to give translation. I forgot to be honest, partly, but sorry for to our Russian speaking.
I try to keep it short.
No, it's okay. Доктор Марио сказал, что это зависит, да, то есть в некоторых, например, клиниках принято, да, работать через сопротивление, все равно они, смотрят на процесс, да, терапии через сопротивление, а в некоторых просто, работают и смотрят, как будет меняться семейная система, то есть работают индивидуально с самим клиентом или пациентом. And you know what, well, I remember, it's always, I had some, I don't know where I have heard it, but sometimes family therapists, people say it's like, football coach, because you have to work with the whole family. It's like a team you have to train. So is it true? It's like the whole system.
Oh, yeah. So, yeah, I mean, sometimes they're fighting and arguing in the session, and you kind of have to learn how to, yeah, you're basically teaching them how to do things different. And so it's just working with a lot of, it's similar to group therapy, but it's more intense because they've been doing it longer. There's a lot of dysfunctional patterns. So,
Yes, okay. I asked, я спросила доктора Марио, да, о том, что иногда семейного терапевта сравнивают с тренером футбольной команды. Он говорит, да, это правда так, потому что они очень много между собой спорят, это действительно очень сложно. You know what I'm watching now, Mario, that all our watchers, I mean people who watch us now, they speak English. So all of them, they speak English. I think maybe we will continue with you in English. It will be more more easier. Yeah, it will be easier for us. And then when we do record of this streaming and we'll put it on YouTube, we will give Russian subtitles. Because as I can see, all these people who are watching, they can understand English, yes.
okay.
Okay. So that's true, yeah, about family therapist as a football coach. It's kind of really difficult. But you had, yes, such cases when people started even like fighting. They not only arguing, they were literally fighting, yeah? Physically, you mean, or just...
Oh, no, just verbally.
Arguing.
Yeah.
Okay.
Yeah, arguing.
And usually you work alone or you have your co-therapist because it's really difficult to work with such a huge family system.
Right. Usually family therapists, not all the time, but a lot of times you work alone. So I work alone. Yeah.
Okay. But there is no, any right or wrong way how to work with, family. So you be alone, and then with some. But you have experience to work with co-therapist. I'm just curious.
When I used to do group therapy, I did co-therapists. So
Okay.
I worked in programs in the past where I had co-therapists for group therapy. I've never had a co-therapist for family therapy or anything like that.
Okay. So we have another question from one of our followers. Gulzat is asking, there is an opinion that families need a family psychology mostly when divorcing. What do you think about it?
I think it's really important to have a family therapist when there is a divorce because it's a really traumatic experience for everybody involved. And I think it can help everybody learn how to, I think, kind of heal from that trauma and also how to work in the new family system because you're creating a new family system, right? So hopefully the parents will be able to co-parent together in a healthy way. So you have to really learn a whole new way of doing things. So I think it's really important. But again, a family therapist would say that really any problem is good for family therapy.
Yes, it's very important. That's true. And at your country, do people often ask for help if they are divorcing? Because here it's not so kind of common. I mean, there are, but not so many. But at your place, at the United States, it's a common practice. They understand, that it's...
Yeah. I think it's probably a lot more common here to seek therapy when somebody's getting a divorce, when a couple's getting a divorce. So it is fairly common here.
Okay, okay. And did you have many cases when, for example, a couple is in the process of divorce, yeah, and when they do this couple therapy, they kind of make peace?
Repeat that last part one more time.
I mean, sorry, my microphone. Yeah, I mean, when a couple is in the process of divorce and when they ask for help, did you have such cases maybe? And it's how to say, many maybe such cases when they take a completely opposite decision after they are in the process of this couple therapy. They change their mind and decide not to divorce.
Yeah,
Does it happen often?
Yeah, not often, but I had it happen several times. Yeah, for sure. Well, I'll just say for me personally, I've never worked with a couple that got a divorce. Every couple that I've worked with stayed together. So I can't say that's true for other therapists. So, but I can say that for me personally. So yeah, I mean, I've worked with a lot of couples and seen them work through a lot of problems and kind of restore their relationship.
Okay, okay, yeah, that's kind of really cool. Yes. Yeah, and we have another question. Yeah, I will ask you. Okay, family therapy can be practicing in any direction, in any school of psychotherapy, as I can understand. This is a question about school or approach in family therapy, or there are kind of definite, like, I don't know, family approach, like family direction.
Right, there's family system theories. So there's a few of them, there's a lot of them actually, but some of the big ones are like what's called structural family therapy. And this therapy, I'm not an expert in it, but it's actually pretty cool in that it talks about how the family is like physically structured. So it pays attention to like how the family sits together in the session, how they choose to sit, who they choose to sit by, and it all means something, right? And so the family therapist in that kind of theory will kind of look at the structure and they will shift that structure around. So they might ask the family to move and change, right? And so it's what it is, like I said, the family has a system of how they operate. So what it is it's changing it. It's redirecting the system and moving it in a different way. So again, it's a pretty cool theory. There's another one called strategic family therapy, which again, I'm not an expert in that one, but there's also Bowen family therapy is a big one. And so Bowen family therapy is pretty cool in that sometimes it works with an individual first in the family. The individual who has the most kind of maturity, emotional maturity, he would work with that individual first and then work with the family again to change how they operate. And so that system also talks about triangles. So
yes.
So in a family, there would be like a triangle. So let's say like, for example, mom and dad don't get along. They don't have a good relationship. So every time mom and dad fights, mom pulls in the daughter on her side. So it creates a triangle. And again, the purpose is it actually helps mom regulate that stress, but it also creates a dynamic where maybe dad is being singled out or dad's being pushed away. And so it just continues to reinforce a negative family system flow. So That's a pretty good theory. Mostly what I use is object relations family therapy. So that's more of a psychoanalytic approach.
Yes, I just wanted to tell, yeah, of course, because it's psychoanalytical approach. Yeah, yeah, I also like a psychoanalytical approach, if even I don't belong to this approach, but I really like it also. Okay, yeah.
So again, if object relations is just the individual therapy, talks about how our individual psychology is from birth with our relationship with mom, and just how safety is created with mom and how she attunes to our emotional needs. And then also what they call the holding environment, the space outside of mom, like dad and whoever else is around, is that safe? And if it's not safe, then how we develop is really in defense mechanisms. So in object relations family therapy, we kind of go back and teach the family how to almost hold each other like the infant and create safety so that they can be their true self, so that they don't have to be angry and guarded, right? Or they don't have to have walls up. So we teach each other how to create the safe space so that you can communicate and flow better.
Yeah, that's really interesting. Yes, because here in Kyrgyzstan, if to tell about experience of Kyrgyzstan, we don't have many family therapists. I even don't know, maybe just 2 or 3 persons who can work here with families in Bishkek. I mean, now I'm in Bishkek. This is capital of Kyrgyzstan. I can speak only for Bishkek, of course. I don't know the whole situation in the country, but these people, they don't have special education. They just have a long experience, and they work with families. But what you are talking about, it's very great, and that's true. It's like a huge approaches. Yeah, they have a strong theoretical basement. Yeah, they have their own structure, and you belong to this object system theories. Yeah, it's really cool. I also like such type of theories. And you know what? Our next question is, I think it's somehow connected. So the price, for example, for a session varies. As I know from school of psychotherapy, it's also kind of varies, yeah. But people are asking about family and individual therapy. So how you I don't know how to say, how you calculate this price for the session if it's family. So it's more expensive because you kind of work with the whole system, or how it works. How do you usually do it?
It depends, but yeah, usually if you're working with the whole family, you can charge a little bit more, for sure. And so how it works here in America is it's kind of like every area you can't charge like way above the normal, right? So you just got to be within the normal range, because there's a lot of laws and ethics that kind of regulate therapy here. So as long as it's within the normal range, you can kind of set your own prices. And so let's say I charge $175 for an individual therapy session. I might charge $200 for a family session, something like that.
Okay. And is there any difference in minutes? I mean, individual session, for example, lasts 15 minutes. If it's a family therapy session, it's, for example, 1 hour, or there is no any difference?
That depends too. It also depends on the theory and your approach.
Okay.
So my sessions are usually about an hour either way, but sometimes if it's a big family, I might do like an hour and 15, and depending. But again, you can charge a little bit more for that as well.
Okay, yeah, okay, I got it. We have several questions
Mhm.
from people who listen us now. Okay, Gulzat again is asking, have you worked with problems kids who have same-sex parents? Is the approach different from traditional families?
I actually don't have a lot of experience with that. So, and from everything I've read, there's not a big difference, right? It's just about being knowledgeable on the specific needs of that group, and just doing your research and seeing what's out there. But yeah, I personally don't have a lot of experience with that.
Okay, yes, okay. It's another, I don't know, it's maybe more like comment or question. How can someone overcome mental health?
One, you got to be open to look at yourself. You got to be open to look at you and how maybe you might be creating some of these issues in our life. So let's say I'm struggling with depression, right? So what kind of patterns do I have that create similar circumstances in my life that make me feel depressed? So I got to be open to look at me. And then you have to be committed. So commit yourself to therapy, commit yourself to reading books, commit yourself to watching YouTube videos, and on mental health, and just be committed and be open. I think those are the two biggest things.
Yes, yes. And maybe if you watch, for example, YouTube videos, you also should be really careful. It's better, yeah, always
Right.
ask
You
a
want to be
professional.
careful. Right.
Yeah,
You want to make sure it's
yeah, because I remember, I have some patients who are coming and telling, I have that diagnosis. How did you know? I put it, I gave it myself by answering questions on the internet, by watching YouTube. This is exactly what I have. You have the same, yeah, problem now. Okay, another question, yeah. So in psychology, we also say that there are some age crises, yeah? And people are asking, what about family crisis? Are there any kind of special family crisis?
maybe, can you give me, like, I'm not sure. Yeah, give an example,
Yeah.
maybe.
So as I can understand, it's one of my students. Yeah, she was asking. It's like in psychology there are some. I don't know how to say. It's like if to remember Erik Erikson theory, crisis of identity. Yeah, it's like a crisis, age crisis. Maybe it's not correct yet translation into English because in Russian language it sounds like возрастные кризисы. So, for example, it's 3 age, 7 age, teenage, adulthood, and blah blah blah. But what about family? Yeah, is there many similar? I don't know, like dividing on the stages on crisis. It's like in family life. I don't know maybe how to say the life of the family.
Yeah, I don't know. The only thing I could say about that is that, again, a family theorist would theorize an individual crisis as a family thing. So, whatever's happening in the stages of development, how is the family facilitating that, or how is the family contributing to that, right? So again, I think that's the only thing I can think of. related to that. I don't know of any family theory that has like developmental stages or anything like that.
Of families, yeah. Okay, yeah, it's interesting. Interesting. I'm not professional in this topic, yeah, but it's kind of interesting, yeah, to have a look on the family life, because as I'm group therapist, I know that it's like sometimes we have such term that the group also have stages, and it's like stages of development, yeah, right. And the groups are dying, yeah. So, but we can't. I mean, family it's also group, but we can't look at this group the same way, maybe as different groups. Yeah, it's interesting.
Yeah, I think there's actually a lot of family theories out there, so that might be something that's out there, but I don't know of it.
And I understood you belong to psychoanalytic approach anyway you like it, but why did you choose this approach? Did you have any maybe other how to say directions that you studied before and then you decided psychoanalytic is kind of the best, or you started from psychoanalytic?
No, I studied a lot of different theories. So in school here, we kind of cover a lot of theories. So we kind of get a foundation of like CBT. We get a foundation of family systems. We get a foundation of, what are other theories out there? Structural or solution focused kind of theories. So we get a kind of a good foundation of a lot of theories, and we can kind of pick which one kind of fits us. So I was always more of doing the deeper work. I always felt like the other theories didn't go as deep as I like. So deep on the unconscious, deep on, again, our past and how that all affects us. It just intrigued me more. It's more interesting. I like the depth of it. Yeah.
Okay. And in individual therapy and in group therapy, we have, it's like, I don't know, it's like, it's for self-care, yeah. If I do individual therapy, I have to be in therapy also. If I do group therapy, I have to be sometimes part of group to have this experience. But what about family therapy? It's the same. You can, if you're a family therapist, you have to have your own family therapist. Of how it works.
You can. I mean, it's not a requirement. I think you should really be in individual therapy for sure. But even in individual therapy, you can work out your family system kind of stuff. But I think it would be helpful for sure to, again, it's not a requirement here, but it would be helpful.
Okay, cool. We have another question. So you see, you are really popular with our watchers, and if even we speak English, it's even more questions that we usually have in Russian. Okay, so people like you. That's definitely a question. Do you think there is a family dynamics that are specific for Asian collectivist cultures?
That's an interesting question. I think there probably is. I think that's probably an area that needs to be researched more, right? And that's an area that we need to explore and kind of get more information on. But I think there's a system, there's a way that things flow, there's dynamics that play out in anytime you get people together, right? Or people, and we have feelings, and we have our past, and we have a lot of things that we bring into a community or family or relationship or anything like that. So I think that's a good question. I think that's something that maybe someone in Kyrgyzstan can start researching.
But you've been to Kyrgyzstan, maybe without researching, maybe you can share with your impression. You have been here, yeah? And do you see, maybe you have seen some families, how do you think? Is there any difference comparing to America?
America is really diverse too, so it's different in different areas. So I come from a Mexican American family, so we also have big families. We're also kind of a little bit collectivist, kind of. So it's kind of similar. There's similar patterns in those kind of between my culture and some of the things I saw in Kyrgyzstan. So
yes, that's true. I kind of also paid attention. Yeah.
So I think I didn't spend enough time there to kind of get a good idea of how the culture is, but I do think it's interesting. I would like to learn more about it for sure.
Yeah, but if, for example, to compare, if you work with families, based on your experience, you told America is also kind of really kind of has many different family structure. That's true. It's but by your own experience, maybe to work with, I don't know, Spanish-speaking, people, not speaking, but people who comes from Spanish family system, it's very similar, as you told, to Asian. It's collectivistic, Is there any difference, when you work with collectivistic families at your place and with a traditional, I don't know how to call America, because that's true, there are many people there, but individualistic, let's call it like that. A really individualistic family where, for example, I am alone, I have, I don't know, 2 children, my husband, and I don't communicate with relatives. And for example, Mexican, a family where kind of cousins, nephews, uncles, they're all my kind of big family, Is there any difference by your own experience to work with them?
There's a little bit of difference. So again, if I work with somebody that comes from more individualistic kind of a system, then really I'm working with where they want to be, what's important to them. So a lot of their goals are more going to be focused on their individuality. Maybe they want to set more boundaries with their family, or maybe it's not even important to them, like repairing relationship with their dad might not be important, so they just want to work on themselves in their own life and kind of learn how to be something like that. Where as somebody from a more collective kind of culture, maybe they can't do that. Maybe they can't pull away, and they have to learn how to work within the system and kind of so there's a difference for sure.
And for you, which one is easier? I don't know, or which one you do like more?
Like I said, I like a variety.
I
like to learn about people. I like to learn about their family dynamics and their culture. So everything is interesting to me. Everything I can learn something from. So I think that's why I like therapy, because it's different. I see different people. It's not the same thing over and over again.
Yeah, that's true. And, I also, for example, work with addiction, as I told you before, and with families. And if to continue, this topic of different types of culture, I here work with Arabic culture. So we have many patients who comes from Arabic countries. It's really different, For example, comparing people who comes from, Europe and Arabic families, they're really different. And, to my personal experience, for me, for example, it's really easy. And I like to, I really see literally after several sessions, the effect of therapy when I work with people from Arabic countries, with fathers actually. It's not about moms, but it's, I don't know, it's not research, it's just my experience and what I see. I didn't do any research, but it's, the fathers in Arabic system, I don't know if I can say like that. It's really easy to have therapy with them. It's I don't know, it's maybe also depends on this type of, I don't know, culture, the place where we live, yeah, but the true therapy is working for everyone. It doesn't matter in which part of the world you are.
Right.
I have never had experience to work with Mexican families, but it's really interesting. Now I really kind of want to try also. Okay, we have another question. What are the actual therapy trends in US nowadays?
That there's a few trends going on. I think one trend that's been kind of happening for the past several years is a move to do more short-term therapy, because what kind of happened here is insurance got involved in therapy. So insurance pays for a lot of therapy now, but they really want short sessions, like 10 sessions, 6 sessions, something like that. Hey, so that's one part of the move. But I'm also seeing a big move here more towards more psychoanalysis, which I like. I'm seeing a lot more therapists diving into the old research of Freud and Jung and Winnicott and Lacan and all those cool people that done a lot of great work. So I'm seeing that come up just recently within the past couple of years, and I'm really excited to see that.
That's interesting, because I know that psychoanalysis somehow lost the influence in the United States in 70s, and now it seems it's coming back. It's really interesting.
It's coming back, so I'm really excited about that.
Yeah, of course, because you are in this approach. Yeah, that's true. Because here in Kyrgyzstan, as I told, we don't have, as I know, people who kind of studied, who has such type of profession, and has special diploma in family therapy. But anyway, psychoanalysis also kind of a little bit popular here. This object theories, it's very popular in Russian-speaking countries. That's a bold tendency, maybe. Okay, another question. This is quite contradictory, right? Psychoanalysis usually takes much more time than other schools.
Right, you're right, it is. And that's, I think we're seeing like companies and clinics do more of the short-term stuff, but I'm seeing a lot more individual practice therapists doing more of the long-term and kind of switching. So again, I definitely do more long-term therapy, and occasionally, sometimes you might meet somebody who only wants short-term, but I definitely see clients for a longer period of time.
Yes. That's a question we often have to be asked, to be honest, because in the hospital where I work, it's a private hospital where we do this addiction treatment. It's a short-term therapy because we are limited with time.
Right. Mm-hmm.
So that is why for many years I worked there for 16 years. For 16 years I can practice this short-term therapy. But I also have some patients who are in long-term therapy. It's like, about 1 year, and there is some difference, and there is some type of, they have different strategies sometimes to do it. Yeah, that's. But to me, to be honest, now when you told I like more kind of long-term therapy, because of course you're in psychoanalytical approach. For me now, I kind of have a question. I don't know which one I like more. maybe anyway, because I was working with many years with short-term therapy. Maybe I don't know if it's true. So it's really interesting. You gave this answer, and I also was thinking. But anyway, it doesn't matter. Any type of therapy is working. We know that. Yes, of course, it doesn't depend on the school or time. Anyway, any help. Yeah. It's help. Another question: how do you think why it is gaining its popularity again? I suppose it's about psychoanalytical approach. Yeah.
Yeah. So I think this is just my opinion. I don't really know for sure, but I think we're seeing a lot of research on the short-term dynamic therapy, not dynamic, but research on short-term therapy is telling us that in the short term, it creates a lot of symptom reduction, but in the long term, it doesn't create long-lasting change. So usually those clients come back for the same reasons, right? They come back again and again. So I think that this is just my opinion. I think that people are starting to recognize that and see that and know that, at least from my perspective, I would rather see a client for 2 years and create change for the rest of their life than see a client for 10 sessions and then they're coming back for the next 10 years. They're just coming back around, so again, I'm not exactly sure why, but again, I think that's one of the reasons. And I also think that a lot of people, especially here in America, they weren't taught the psychoanalytic theories in school in depth. So now that they're out of school and they're starting to learn it, they're starting to figure out, well, I like this approach better, right? So we kind of have to learn it on our own here because a lot of our training programs are all kind of moving towards the short-term kind of models.
Yeah, okay, and maybe it's my last question, yeah, because we are already 1 hour speaking with you, yeah, so because I can't see any other questions from people who are watching us, yeah. So now we have this tendency to online therapy, yeah, and it's most common question, yeah, when we ask, do you see the difference between face-to-face and this online therapy? Which one do you use now more? Oh, you prefer maybe?
Right. Well, right now I'm doing all online therapy. Right now, I did face to face most of my career, but the pandemic kind of changed all that. I think for me, I'm actually not seeing a difference in my results. I think it just depends on you and how you're connecting with the client and what you're picking up on. Because I think, especially psychoanalytic therapy, it's about being attuned to what's happening in the space. And I think you can create that if you, like I said earlier, create the holding space, create the safe space for them. You can do that online, but you have to be creating that environment for them.
Yeah, that's true. Yeah, thanks for the answer because, I can see the tendency. For example, you are in this approach, but for you it's very easy. But from some, to work online, to tell about, this therapy online, and you can't see the difference, between online and face-to-face therapy. But I know some colleagues who are in this approach, psychoanalytical approach, and for them it's very difficult, there's kind of, it's like, the whole story to create this safe space, as you told, not in the room where they used to work, face to face, but in this space online. Yeah, that's interesting. Yeah, thanks for the answer. Yeah, thanks for coming to our online streaming. And I will tell something in Russian because we kind of discussed with you some possibility, to have you as a lecturer for our students here in Kyrgyzstan, about family system, maybe theories, maybe some psychoanalytical approach, and I will give this kind of notification now in Russian, okay? спасибо, кто смотрел нас сейчас, да, наш эфир, но мы сделаем перевод, увидите перевод на нашем канале YouTube с субтитрами. И я сказала, что я попросила доктора Марио, что если у вас будет интерес, он может быть нашим лектором. И мы можем попросить его прочесть семинар для той аудитории, которая принадлежит психологическому сообществу и которая смотрит нас. Не те, кто учится, не то, кто, извиняюсь, просто интересуется, да, психологией, а может быть, как-то является профессиональным психологом или изучает психологию. И если у вас будет желание и интерес, то напишите комментарии под этим видео. Может быть, вы выберете даже одну из тем, которые мы обсуждали с доктором Марио, и мы его пригласим быть лектором для нас. So I just told you that if someone will have the desire, we invite you to be our lecturer, not a guest on this Instagram, streaming or on air, how it is called, but to be a lecturer and to teach, our psychologists here, maybe any topics that you like. People are they're thanking you.
Пожалуйста.
Спасибо. You see, amazing. People say amazing. It's really kind of cool that you agreed, and it was really good. On air, I really like it. I hope people who were watching us also liked. It was very informative. Very safe, as you told. So you were able to organize this space. Thank you. And I hope to see you on our maybe seminars, and maybe again you can come to Pakistan and see, and to do this research as you told. Okay, thank you.
Thank you. Have a good one.
Спасибо большое. Okay, good night. It's night at your place. Okay, goodbye. До свидания, все, кто нас смотрел. До новых встреч.